The formation of the philtrum in the lateral portion of the upper lip occurs during the first 8 weeks of fetal development. An interruption during this time may result in a cleft lip. A cleft lip is repaired in stages, with the initial repair at 10 to 12 weeks after birth and a Z-plasty incision is used. This procedure may also be called a cheloplasty. A cleft palate is sometimes seen with a cleft lip, but they are separate malformations and are rarely related to one another. Repair of the palate is done mainly to restore the normal function for speech. An atrasia is the absence or closure of a normal anatomical orifice. An esophageal atrasia is a non-genetic defect in which the esophagus is interrupted. The upper portion ends in a blind pouch that does not communicate with the distal esophagus. This prevents the normal passage of food and saliva to the stomach. A tracheoesophageal fistula is a direct passage or duct between either distal or proximal esophageal section and the trachea. If the TEF is between the proximal esophageal segment and the trachea, saliva and milk are aspirated into the lungs. If the fistula is in the distal esophageal segment, then the gastric secretions flow into the lungs. The goal is to restore continuity to the esophagus. A pyloromyotomy is a surgical procedure to correct infantile hypertrophic pyloric stenosis. Pyloric stenosis is a congenital anomaly involving the longitudinal and circular muscular fibers of the gastric outlet, resulting in a stricture. The pylorus of the stomach is enlarged and the edematous, causing food to be regurgitated almost immediately after intake. This procedure can be done laparoscopically or as an open procedure. If an open procedure is done, the incision is a right upper subcostal transverse incision. Hirschsprung disease, also called megacolon, is characterized by congenital absence of the ganglion cells, which controls the relaxation and contraction that occur in peristalsis. This disease can be recognized soon after birth and is confirmed by a rectal biopsy. Delayed diagnosis may result in necrotizing enterocolitis, which can be fatal if not treated promptly. The goal of the surgery is resection and reconstruction of the distal colon to restore functional peristalsis to prevent bowel obstruction. Imperforate anus is a congenital malformation of the anal rectal system in which the rectum and anus do not communicate with the outside of the body. Repair is done to provide continuity of the lower intestines to the outside of the body. A colostomy is also performed on the neonate for diversion of the feces until surgical repair is complete and the recto and the anus are functional. Intussusception or telescoping of one portion of the intestine into another is the most common cause of intestinal obstruction in children 3 months to 6 years of age. It can be reduced with a hydrostatic pressure from a barium enema or by manual manipulation via laparotomy. A volvus is a rotation of the intestine around itself or the attached mesentery. This is a rare condition, but emergency surgery is done to prevent bowel perforation and peritonitis. The goal of the surgery is to reduce the volvus to relieve intestinal obstruction by untwisting the affected bowel. The central part of the intestine normally rotates into its final position in about week 10 of pregnancy. If this part of the bowel does not fully rotate, it is not predisposed to malrotation or twisting later. A congenital anomaly in which the abdominal viscera develops outside the body is contained within a peritoneal sac is called omphaloceal. This sac can contain intestines and other organs such as the liver and spleen. The anomaly is often associated with other genetic defects. Gastroschisis is similar to the omphaloceal, except no peritoneal sac or membrane covers the abdominal viscera outside the body. The exposed bowel is often thickened with edematous and may be abnormally short. This anomaly may not This anomaly is also not associated with other anomalies, but intestinal atresia may be present.